Hey everybody, Dr. Schiller, and today I want to talk about why do people get stuck with chronic pain and chronic illness and what you can do about it. And we're going to start in particular talking about irritable bowel syndrome, fatigue, chronic abdominal pain, which often goes along with anxiety and insomnia. And there's potentially more to it. There's various constellations of symptoms that people get that are really disabling. And conventional medicine doesn't really have good answers frequently for those issues. And in my eyes, part of the problem, according to the way I trained in conventional medicine, is that we tend to think of each of those symptoms as a separate problem. And we tend to not see that they are connected to each other based on underlying physiologic imbalances that are common to a lot of those symptoms. And so abdominal pain, fatigue, brain fog, chronic fatigue, neuropathy, headaches, even things like dementia, confusion, cognitive changes. There are underlying physiologic principles and imbalance that are connected with each other. You're one unit, all your systems are connected to each other. So we're going to explore that so you can understand it. This is stuff that's not made up. It's stuff that's based on scientific evidence coming out in the past 20 or 30 years, but it can take decades for that to get into common mainstream medical practice. And what I see over and over again is someone who comes to me and they've had the best medical treatment. And thank God they haven't had a disease that's progressive that's going to kill them. But they have ongoing symptoms. And the docs either gave them meds that didn't help them or gave them too many side effects. Or you know what, they just weren't listening and understanding the whole picture. And on the other hand, I've seen a lot of people who have gone the more natural medicine approach, and they've gone one aspect out of that, or two aspects, but they haven't really holistically understood the depth of the underlying physical dysfunction. And so I want you to understand that, so you can understand what might be going on in your case, so that you can know what you might need to do and what you might be missing. And the whole point is that you should feel better. So that's where we're going. I want to do this in the context of a case. I want to talk about a guy who came to see me. And his name's Robert. He's in his 40s. Basically what's going on, he's exhausted and he can't get moving in the morning. He can't function. He's got chronic pain in his belly. He's got so much like diarrhea every day, especially in the morning, that he can't really leave his apartment for a while. He's got gas and bloating. He feels anxious a lot. Lately, he's not sleeping so well at night. And sometimes he just can't kind of get motivated because he feels so overwhelmed about all the different stuff going on. So things are kind of like over the top for him. And the physical issue started about 20 years ago, and he had a very stressful time during his higher education. And stuff was going on that was maybe even on the level of like emotional abuse with some of his teachers, what they were doing to him. Turns out that he also had some emotional and physical trauma when he was a child. There was probably some abuse. There was his own subjective sense of being neglected by his parents. And over the years, he tried various psychotherapeutic things. He's always felt kind of not at ease with himself. He's tried various psychotherapeutic approaches, but never really stuck with anything. And lately, he's had a lot more difficulties. He got divorced several years ago. He's had other challenges. It's hard to move forward professionally. He doesn't emote. He feels like things are kind of bottled up a lot inside. And he wants to move forward. He's got clear goals. He's actually a great guy. But he's having a hard time doing what he knows he needs to do. And so I did an evaluation. We did a little bit of testing. And here's what it showed. We did what we call a 24-hour cortisol secretion, which means like 4 times over 24 hours. We look at a saliva test and we see how much cortisol is in his saliva, which has been shown to reflect what's in the blood. And what is cortisol? It's one of our stress hormones, and cortisol is regulated by a feedback loop. So you may have seen other videos that I've made where I talk about like the stress system of the body. And then we have an acute stress response, which is part neurologic and part from epinephrine, norepinephrine, which are also called adrenaline and noradrenaline. And cortisol is a hormone that's also secreted in response to stress, and it helps modulate certain aspects of your physiology when you're under stress. But it also kind of has a kind of tempering effect on your acute stress response. It's more like your chronic stress response. And cortisol is subject to all kinds of feedback. You know, in this cartoon here, this diagram, here's your adrenal glands. That's where cortisol comes from, and so do epinephrine and norepinephrine. And that's all under control of your hypothalamus, which is in the core of your brain. There's a normal daily rhythm of that secretion, but stress or inflammatory signals, things called cytokines, stimulate the pituitary to stimulate the adrenals, and that's what puts out the cortisol. And there's a feedback system to the pituitary, a feedback system to that hypothalamus, and it tends to modulate and balance things. Now that feedback loop gets out of balance in people who have chronic stress, and it's shown to get dysregulated, and that's one of the things that's going on in chronic fatigue syndrome and lots of people with fibromyalgia and frequently other chronic illnesses. So let's unpack this a little bit so you can really understand it. I want to go back to Robert's actual testing, right? So this is a graph over 24 hours, like early in the morning, at night, and then at noon in the afternoon. And this green band is kind of like, that's normal cortisol secretion. And check out where he's at. He's below normal, especially in the morning, relative to the green, where he's kind of closer to that in the afternoon and evening. But in the morning, he's pretty darn low. And there's also something called DHEA, and that's kind of a precursor to sex hormones. And it's often also modulated or downregulated in people who have a chronic cortisol response. And so that morning low cortisol is something that could be expected to really cause him to be really fatigued and not be able to move himself in the morning, because cortisol is parts of what gives you your bump. And so we're seeing some real physiologic data that this guy is really suffering from a dysregulation of his hormonal system. And a lot of people with fatigue are experiencing that. So let's go a little further. Let's take a step back and think differently about chronic disease. When I was in medical school, they didn't teach me systems biology. They taught me a fairly kind of cookbook method of thinking about really a simplified way of understanding things within each organ system. If there's high blood pressure, you do this. If there's pneumonia and inflammation, you do this. If a person's got this kind of hormonal problem, you give this drug. And systems biology is looking a little bit more complex-wise, a little more complexity. And I actually got trained to think about this way when I was an engineering student at MIT. We modeled complex systems and understood how all these different variables interacted with each other. And I was a little disappointed when I went to medical school, like, really? You guys are thinking so simplistically about stuff. But it actually works in acute illness. And if you have an acute illness, you want to go to the emergency room. You want the antibiotics. You want the person who's going to stop the bleeding, or if your blood pressure is 50/20 and you're passing out or dying, you need that kind of acute care, which is fairly straightforward and simple. The place where that model tends to fall down is with chronic illness. It's getting better, but it's a slow process. So let's just talk for a second about what is systems biology. First of all, we understand that all the systems are one system. So your cardiovascular, digestive system, your hormonal system, your immune system are profoundly interconnected with each other. There's complexity and relationship among all of the parts. All of the reductionist detail that the specialists are thinking about, whether it's an endocrinologist or rheumatologist or a cardiologist who knows so much detail about their particular organ system, well, we try to take that and put it in the context of your overall integrated biology. And we try to look at patterns that give rise to problems over time, as opposed to just looking at one snapshot with a bunch of blood tests or, a scan or something like that. We want to look at, well, what was it like when you were born? What happened during the course of your life? And how did this process that you're in unfold? So let's unpack that a little bit more. And let's look at this contrast. And, conventional medicine really was formed by this miracle that happened when they developed antibiotics, where suddenly people who were dying of streptococcal pneumonia were living because they discovered penicillin. And this one disease, one cause, one treatment model dominates a lot of medical thinking. And even into this day, when we've got research showing how many different variables are involved, I find a lot of my colleagues really in this kind of like, well, is it this or that? What's the cause? And a lot of patients come to me and say, well, what caused it? And the fact is, well, about 5 things caused it. And it happened over the course of 20 years. So let's try to understand it that way. And it's hard to get your head out of that one disease, one cause, one treatment thing. And again, each doctor has their own particular algorithm for fairly simplistically treating things. Patients usually pass it, do what you're told. And it's mainly about acute problems, and it's not great for chronic problems. And functional medicine is different, systems biology, and the main point of this whole slide is that we look at antecedents, triggers, and mediators. I'm going to unpack that in a second, because that's what helps us understand how that disease process develops over time. We want to understand the process, address underlying issues, and enable the patient, which might be you, to be proactive and to do things that are lifestyle-oriented that actually can help you heal. So let's talk about antecedents. These are like foundational principles, like things that are early in life that set the stage for your whole life. We're going to get more into detail, don't worry. Triggers are transient events that come and go, but they shift your system in a significant way. And then mediators, these are things that are kind of persistent changes that keep you stuck in a disease pattern. So let's unpack this some more. Antecedents, triggers, and mediators. The thing I want you to know is this, really important, listen up. These things are interacting over time. It's a process. It's like something flowing downstream that can start when you're a little kid, that can be triggered when you're 12 or 16 or 18 or 20, that can get worse over time as it progresses and get re-triggered when you're 40, and then suddenly you're 49 and you're sick. And the conventional approach is, well, what's wrong with you now? As opposed to, well, how did this all develop? And let's look at how that unfolded over time, because that gives us clues about what we can treat. One way we like to talk about it is that conventional medicine tends to be downstream medicine. The person's already sick. What are we going to do about it? And in functional medicine, we try to go upstream. We try to find that process and get at its roots in an upstream sort of way. So antecedents, like I said, set the stage. What are we talking about? Stuff like genetics, early life experience, culture. These things determine physiology. And triggers shift the system. Examples of that are things like infection, trauma, surgery, an acute illness where someone's in the hospital for a while, life event, intense treatment with medications. These things modify metabolism. They change your beliefs and emotions and behavior. They can affect gene expression and function of the genes and the physiology of every system in your body. And those become mediators. And that's what keeps you sick. Metabolic biochemical changes, mental emotional changes, social changes, behavioral changes. And let's unpack this a little bit, right? This is going to be kind of a simplistic picture that will go into more detail. But let's, for instance, just think about your brain, right? And your brain is the place where you perceive danger, and your stress response happens through your brain. It's a perceptual thing. It can also happen through your body, because you can have a physiologic stress. But look, we'll get into that later for a second. So we're understanding now that the brain and the gut are incredibly connected. There are journals of gut-brain axis connections. If you look in almost every specialty journal, whether it's rheumatology or cardiology or orthopedics, nephrology, gastroenterology, and so on, all of them are talking about the gut-brain axis. And part of what happens is like this, that there is this two-way communication, and we'll go deeper into this, but some of the predominant changes that happen in your gut are dysbiosis, which are changes in the bacteria of the gut, inflammation, increased permeability, and inflammation. I said inflammation twice. Sorry about that. Anyhow, we're going to unpack this some more. Those changes tend to dysregulate the immune system, and that can be making the immune system overactive or underreactive. But the point is your immune system is meant to be in balance. And oxidative stress is actually a biochemical stress that is part of immune dysregulation quite frequently, and they have a cyclical relationship with each other. And going further, your mind-body connection is profoundly integrated with your immune system and your tendency towards oxidative stress. Oxidative stress is biochemical stress that your entire body and mind experience as stress. So stressful experiences can whack out your immune system. Immune dysregulation and oxidative stress can affect your brain function. I want to point out something else here. Like, okay, we all understand that stress and perceived danger can affect your brain, but what's with this area? The fact is, and this has been shown over and over again, that when a person's in a stressed mind state, they are not thinking clearly. They're not relating to life with clarity. There's a shift in brain function and brain connectivity in a stressed brain that actually leads us to perceive danger more frequently when it might not even be there. There's something called negativity bias, where we're all kind of biased to look out for danger. But someone whose stress axis is on overdrive has an overactive, vigilant tendency to look out for danger. And you may have heard of things like PTSD, where someone has an overactive stress response and, something happened to them in the war or whatever it was, and they have some kind of simple stressor that most people would just say, oh, that's just the car making a noise, but this guy's jumping in for cover and diving for cover. Let's unpack this a little bit more, right? I took the arrows connecting the brain and gut out just so it wouldn't be confusing. This is a little diagram that just shows your pain pathways. Now, I'm going to unpack this later, but the fact is your experience of pain, whether it's in your body, in your hands, in your gut, wherever it is a sensory phenomenon where certain nerve endings are activated, but that signal cruises up through your spinal cord where it gets conditioned and altered and goes into the core of your brain where it gets altered, and then it goes up to the part of your brain where you say, ow. And the point is, you've got amplifiers. Your system of pain transmission can be turned up and it can be turned down. Immune dysregulation has been shown to turn up your pain amplifiers. When people have systemic immune activation, they frequently have central brain inflammation. And that's part of what creates hypersensitivity of that pain transmission system. And that's what shows up in fibromyalgia. It shows up in a lot of chronic pain states like peripheral neuropathy and osteoarthritis. And for sure, it shows up in irritable bowel syndrome where people get really bad pain just from eating normal stuff. Part of it's the way their gut is reacting. Part of it is that their pain pathways are amplified. The volume is turned up. And it doesn't mean they're faking it. It means their biology is turning up that pain processing system. One more step here. We want to just think about cellular function. This is like a goofy cartoon of a cell. And you got these little organs in your cells called mitochondria. And mitochondria are part of what makes cellular energy. And cellular energy is what lets you have energy. You've got millions and millions of mitochondria that are constantly active. They're power plants. They're everywhere, especially active in your brain and your muscles and your heart. If your mitochondria aren't functioning, you're not functioning. And all of these changes that we're talking about, like immune dysregulation and oxidative stress, can stimulate dysregulation of your cellular function and your mitochondrial energy production. And when your mitochondria gets sick, it activates your immune system and oxidative stress. Stress itself can trigger the mitochondria to shut down and turn off, especially when it's chronic ongoing stress. In the short term, stress pumps you up. In the long-term, chronic stress knocks you down. And also mitochondrial dysfunction keeps your brain from working properly, because if your brain's not producing energy, what's happening? Brain fog, fatigue, confusion, etc. The point is, we got vicious cycles. We got cycles of interaction of these physiologic processes that can be triggered by all kinds of antecedents, triggers, and mediators. What else is here? Oh yeah, don't forget pain and mitochondrial and cellular function, because for sure, your nerves are cells, and if your nerves are not properly functioning, they're going to get sick and they're going to generate more pain. So look, I want to unpack this some more. I'm going to talk more detail about this with some more scientific pictures. And we are getting to about the 20-minute mark here. And so you might be like a lot of my patients where, okay, the concentration, memory might be a little challenged because of the chronic illness and the things we're really talking about here. So we're going to cut this vid right now. And part 2, we'll go into more depth about really understanding more of the science behind these kinds of changes and how this constellation of underlying physiologic imbalances or changes can give a rise to a lot of different symptoms and really disabling conditions. Keep a lookout for that, and you can watch it right now or come back to it later when you got more energy. Thanks a lot for watching. Make sure to subscribe, share with your friends, and see you in the next video.